Flu cases are also surging all across the country. The CDC says nearly 5 million Americans have already been sick. Doctors expect that number to keep climbing as people begin heading back to work and school after big holiday gatherings. Joining us this afternoon to talk more about flu spiking is Dr. Zachary Most, an infectious disease specialist at Children's Health and an assistant professor at UT Southwestern Medical Center. Thank you so much for being with us. We appreciate it.
Thank you for having me.
Okay, this is certainly the typical time for a spike in cases, but is anything different this year? We've been reporting on a new strain, that subclade K. Is that a unique reason for concern?
There is a new subclade of the influenza virus that's circulating in our community, one that most people in our community would have no prior immunity to, and one that may not be covered that well by the vaccine. But there actually are new subclades that evolve of the flu virus all the time. So this isn't really a brand new phenomenon, and it just sort of poses what the risk of flu is to our community all the time.
Absolutely. Okay, well, let's focus in on young people. What would you say are the number 1 or 2 symptoms that parents should really be looking out for?
The most common symptoms that people have with flu are a high fever with a cough and a sore throat, and often with muscle pains and headache. Sometimes the symptoms will be more mild and be somewhat indistinguishable from a cold, but occasionally they'll even be more severe and can spread to the lungs and cause a pneumonia, leading to difficulty breathing.
So that brings us to this point. When should we know it's actually time to go to the ER or to urgent care? I guess the question is, maybe you've been taking care of yourself at home, you've been taking care of your child, they're feeling okay, and then suddenly things feel like they're taking a turn. When's the right time to seek care?
Yeah, I would definitely recommend, if any questions that you have about, where should I go to get care? Should I go to the emergency room or not? To first reach out to your primary care doctor and open that conversation. But some warning signs to look out for that may warrant a trip to the emergency room are difficulty breathing, dehydration, seizures, or anything else that really worries you that warrants immediate medical attention.
Any tips for trying to limit the spread? I know it's really difficult given that we've probably already had a lot of holiday gatherings, but any just specific tips that can keep us all safe?
Yeah, I mean, the best way that you can protect yourself from the flu is to get a flu vaccination. CDC and the American Academy of Pediatrics recommend annual flu vaccination for everybody who's 6 months of age or older. And it's not too late to get it. But the longer you wait to get your flu vaccine, the less likelihood you're going to get protection from it. So I would encourage people who haven't gotten their season flu vaccine to get it. But other things that you can do include staying home while you're sick, so you try not to spread the virus to others, washing your hands really well, cough etiquette, like trying to cough like on the back of your arm or your hand rather than out into the environment. And for certain people who are at high risk of flu, if you know you've been exposed to it, you can reach out to your doctor because you can even take antiviral medicines to help prevent the flu.
Yeah, and speaking from personal experience, that flu shot can definitely mean a milder case if you're unlucky and you do get it. So it does make a positive impact.
Yes, I agree.
All right, Dr. Most, we sure appreciate it. Thanks so much for being with us, and Happy New Year to you as well.
Thank you, and Happy New Year.